If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got a really special guest with us, Dr. Alex Miquel.
Yes, sir.
From Men's Only Medical here in West Palm Beach. So I know you're a busy guy, so thank you for coming in and sharing some insights of what y'all do.
Yeah, thanks for inviting me.
So tell people where you're at and what you do.
Yeah, so I just opened a place, Men's Only Medical, had our grand opening in June. We're in downtown West Palm Beach on Dixie, between Banning and Clematis. It's 116 North Dixie Highway. And we just created it's a kind of combination all-in-one men's health facility where we do concierge medicine and provide primary care to members who pay a yearly membership. And on top of that, we have a wellness center. We provide aesthetics for men, from Botox to laser treatments. We do hair solutions, from hair transplants to hair restoration with PRP injections. We do IV fluids, hormone replacement, weight loss, peptides. You know, we try to incorporate many of, if not everything that a man would need, all under one roof.
It's awesome.
Yeah.
So family practice, that's your main education background.
Yeah, that's by training, I'm a family physician, yeah.
What led you to that versus like orthopedics or cardio or?
Yeah, it's interesting. You know, I'm a third generation physician. You know, my grandfather was a surgeon in Cuba, and then my father came when he was in his early teens, grew up in Miami after that, and then went off to medical school himself and became a family physician. So growing up, I just watched my old man do what he did. And I like to kind of consider those the glory days of medicine. And I would go to the office all the time and just spend time with him at the office, watch him treat his patients and see the relationship he would establish with his patients. And I just thought it was so cool. You know, not only did I get to see so many people come and just appreciate the service that he was providing for them, but the services that he was providing helped improve their quality of life. You know, it either made them healthier or kept them healthy longer. And as a kid, that's all I could ever remember that I wanted to do. And it wasn't just going to medicine. I wanted to be a family physician. I wanted to treat the whole family. I wanted to treat kids and adults. And what do they call family physicians? We're like the jack of all trades, the master of none kind of thing. So I didn't have to limit my training to one particular field. I got to learn about every different organ system, every different body part, and dabble in everything from surgery to OBGYN to pediatrics, adult care. It was just so all-encompassing that's just what really intrigued me as a young kid. Yeah,
it's awesome. That quote, "Jack of all trades, master of none," is still better than a master of one.
Right. Yeah.
That's the thing. I was like, see, okay, yeah, I like that. You know, because I've been called that too, like some stuff. So and then what led you to pursue like opening your own practice in a concierge setting?
Yeah.
Versus where you were previously.
You know, I think going back to when I used to watch my dad practice medicine back in the 80s and 90s, that it seemed to me like a great situation where he had his own private practice. So he was a physician, but a small business owner. He got to establish a rapport with the patients, find out what was wrong with them, and then work with them to achieve their goals. And you know, if he felt that there was a certain medication he needed to prescribe, he could prescribe it. If he felt that there was a certain study that needed to be done, he could order it. And then as the years went on, things started changing. When they started getting into this managed care, they started shifting all the risk onto the physician and away from the system and away from the patients. And then they started cutting reimbursements. And they really made it difficult for physicians to practice independently. The insurance companies these days are really kind of pushing their protocols and what basically dictating what they want you to do for all of your patients. And it started to get frustrating. Then I graduated, did my residency, and got out and realized really quickly that it was going to be virtually impossible for me to have my own private practice like my old man did, because I would have to see 30-something, 40 patients a day in order to keep the lights on and make a decent living. And when you're doing that, you're not providing the patient enough time to even learn about them, establish the rapport, earn their trust, and find out what's wrong with them. or
deliver the care that they need,
or deliver the care
that's not dictated by a third party.
Correct. You
It's
know,
like,
and
no, we're going to go this direction.
Right.
Like, I don't think they need this. Okay.
Right.
Well, then denied. It's like,
Right.
well, then what do we do?
Automatic denials, you know, for imaging studies, certain medications. And then you have to just go through this gauntlet of phone calls and peer-to-peer calls to try to convince them that your patient needs what you felt they needed all along.
Yeah.
And
that's for one patient.
And that's for one
times
patient.
30 a day. It's ridiculous.
It's ridiculous. And, you know, I've known for a long time that it wasn't sustainable for me. I don't know how sustainable it is as a profession, because I'm seeing a lot more physicians just being discouraged with how the system has changed. A lot of really good physicians are getting out of traditional healthcare and going into concierge because it empowers you to be able to kind of practice that old school medicine again, where you can just sit down and talk to your patients. You don't have to rush them in and out in 10 minutes. You can provide them 30 minutes, 45 minutes, an hour if you want to. You really can find out what their goals are. Not everybody wants to be reflexively put on prescription medications, you know, and I feel like the healthcare system these days, and even though family medicine focuses on preventative medicine, we're practicing a very reflexive type of medicine where we're just treating a disease process as opposed to trying to really focus on the reason that these disease processes are going on.
Like the underlying cause.
Yeah, the underlying cause, exactly. So, you know, for me, it was probably 10 years later than I would have liked to have made the conversion, because concierge medicine has been around for a while. But they don't teach you much business when you're going through medical school and stuff. And it's a scary venture to go into, opening your own business, whatever it is, if it's in healthcare or anything else. Yeah. So there was probably a little fear in there and a lot of just not knowing, you know, how to do it. But at the end of the day, I just knew that the world of concierge medicine allowed me to practice medicine the way I felt like I wanted to practice it, and not just following these protocols and these metrics that the insurances are kind of pushing out and forcing you to follow.
When was that shift in healthcare system where insurances, you know, they're strong arming everything pretty much?
It started in the early to mid 90s. Managed care really started taking off in the early 90s, 93, 92, 93, 94, around there.
What led to that?
I think it was cost control. I think there was probably some decent reasoning behind it, and then it just kind of went way too far. Yeah. So I think they wanted to control the cost of healthcare, and to be honest, and it's just my opinion, I felt like there was so much money in healthcare that everybody wanted to put their hands in the honeypot. You know, one thing I tell people all the time is when my dad passed away in 1996, he was 50 years old, had a heart attack, unfortunately. Wow. When he passed away in 1996, as a family physician, he was making more in 96 than my wife and I were making when we moved back to West Palm Beach in 2012, both being physicians. She's a pathologist and I'm a family physician. And our two salaries combined was less than what my dad was making back in 1996. So I just don't know any other profession off the top of my head where all these decades have passed and people are doing worse financially. And the stress increases because now you don't even own your practice. So you always have management and some office manager or somebody, medical director, who's on your back about seeing more patients. Pushing productivity and pushing certain products, you know, and it's just frustrating. Wow.
So y'all are just like, I mean, those docs are they're just pawns. Like they're just being... They're puppets.
They're puppets. Yeah. I mean, I would joke around all the time, you know, when I was practicing direct patient facing care, that if this is how it's going to be, I could put my son in here and just give him a paper and tell him this is what you have to do for this patient. Yeah. You know, and it, you know, I think we could probably talk for hours about all the things I think are wrong with healthcare. But for me, it was the right move going to the concierge. And I'll tell you what, ever since we opened this place up, I have this newfound just passion for medicine again. I was waking up every day miserable and just not wanting to go to work, knowing it was going to be a stressful day. What I've said before is I kind of equate it to like, since I've always wanted to be a doctor since I was a kid, I finally got there and kind of got like hit in the face with all these changes and disillusioned with the system. And I equate it to like, you have like your idol, you know, if it's an athlete or an actor or whatever it is, and you finally meet them and you find out they're a dick, you know, it's just like, or they're like a jerk, you know, that's what happened to me with healthcare. So going into concierge medicine now has me waking up every day just happy to go to work,
excited.
Yeah, just smiling all the time, just happy.
It's so interesting because like very similar to the same story that I had. Like it was the same kind of thing. I mean, just like because physical therapy, you know, ortho outpatient, sports PT, whatever, it's all the same kind. It's just dictated by insurance and stuff, and you're just a puppet trying to get the productivity for whoever owns the practice or the business or whatever like that, and then just to funnel patients and just do more units. Why did you only do these units? You know, we need more units.
Right.
It's like I don't understand how I can possibly give. And at the end of the day, still do documentation.
Oh yeah.
Yeah, it sucks. So like you're drowning all the time.
Oh, it's miserable.
So anyway, I did the same thing, you know, 6.5 years ago, and I was like, it's the same thing I tell people. Like it reinvigorated my passion for like, this is kind of fun. Like there's a reason why I went into this. Like I can put puzzle piece things together and like problem solve and like work with people, talk to them one-on-one for an hour every time, work about progressions, and like, anyway, just get excited about using talents, knowledge, and skills to my ability versus just like, I don't know, just surviving the day.
Right.
And then drowning.
Right.
You know, it sucks.
And ultimately drowning. Yeah. That's what you get. And at the end of the day, the more time you spend with your patient, the more trust you can earn, and the better outcomes you have.
Oh, for sure.
You know, because now they really trust you. They really feel like you know what you're talking about. You're developing a relationship. I don't know if you want to call it friendships or not, you know, with patients and stuff, but you're establishing relationships where they want to come back for their follow-ups. They want to listen to your advice. And if you're just shoveling people in and out, they're leaving frustrated too. And I'm like, I'm not going to take this stupid.
Yeah, the only people get hurt are just the patients, and then the providers that are getting deflated, like you were saying, like, you know, drowning and stuff. We had a patient that she's a physician in the area too, and she's in the in-network like hospital type of a system, drowning. She's like, she goes home, she spends her whole weekend having to finish her documentation to start on Monday again. Where like they had no time, and they're just like pumping out the communication with administration and then like the other team docs and whatever is just really poor. So patient continuity or patients gets dished off or dished over or whatever. Like, anyway, she just doesn't like it. You know?
Yeah. You know, and we bear the brunt of a lot of the discontent from the patients because they almost blame us for it.
Yeah. Right.
And what they don't realize is that we're as frustrated as they are. Yeah. You know, I felt it when I was a patient in the hospital. I went in for, I don't remember what it was. When was the last time I was in the hospital? It was years ago. But I remember laying in the hospital bed. I had a surgery on my Achilles, and I had a lot of pain over the night.
You had an Achilles repair?
I blew my Achilles out being a weekend warrior.
Playing
softball.
That's all I was gonna say.
A buddy of mine had a tournament going on at work, and they allowed them to bring, you know, one or two guys that weren't related to the company. He invited me to play. Hit the ball, thought it was a home run. So I'm doing like my home run trot and rounding first. And I look up and I see it hit off the top of the fence. So I went from like a trot to a sprint. And as soon as I planted that left leg, I felt the pop.
Wow.
Yeah, I was miserable. But after the surgery, I was in a lot of pain. And I remember asking the nurse to get me an anti-inflammatory because they had prescribed morphine or something for pain. And it just wasn't working. And I didn't want it anymore. I wanted the anti-inflammatory. And about an hour passed, and she walked by again, and I'm like, did you ever hear back from the doc? And she's like, I haven't even had time to call them because I had to do my documentation. If they don't finish their documentation before a certain time, they get dinged. So now patients in the hospital aren't getting the care they need from their nursing staff, from their physicians, all because of this documentation. And it was supposed to streamline things and make information sharing better.
Right.
But all it does is occupy the healthcare professionals' time more, and none of these EHRs really communicate. So they're all independent systems. So the data sharing is really the same as it was before when you had handwritten charts that you still have to fax it or email it to somebody. You know, so that's another thing that I think kind of backfired in healthcare too.
I believe it. Yeah. You know, that's a bummer. So all right. So now you're doing, it's men's only medical. And you're seeing men from 18 years old and up.
18 and up. Yep.
What led you to want to do men? It's like, hey, I want to open a men's only.
Yeah, no, that's a great question, and it kind of goes against the grain because men are the ones that access healthcare less than women. We're just, we're too proud or, or even embarrassed to talk about what's going on with us.
Yeah.
So I think
you got to project toughness, right?
Yeah. We have to be a guy.
We're strong.
Yeah.
We're providers.
And to an extent, I kind of buy into that, but at the same time, we do it to our own detriment sometimes. And so the easiest thing would have been to do either a family concierge or an all women's concierge, but there's nothing out there for men, and being a man myself, I just felt like, man, if there was like a cool place where guys could go, feel comfortable, have, manly colors on the wall, leather couches, just a certain vibe and feel to it, that men would come. It's kind of like Field of Dreams. If you build it, they will come. So we kind of threw caution to the wind. My business partner and I, who's one of my best friends from Cardinal Newman High School. I'm a local guy here. His name is Chris Lazara. And we went into this venture together. And when we were talking about it, we're like, what can we do to kind of differentiate ourselves from the traditional concierge practice? And we're like, let's do men. I'm very passionate about, I don't know, it almost sounds weird to say I'm passionate about men or men's health.
Men's health, yeah.
But it to me, it's a calling because I live through all these things that guys are going through. If it's the decrease in hormone and energy levels, if it's issues with your libido, if it's issues with confidence, if it's hair loss, whatever it is, I'm also going through it. So I just felt like,
That's good though. It adds credibility and like a trust factor.
Right.
Like I know you're going through.
Yeah.
I've been through this.
Yeah. And I think it makes it easier for me to treat the patient. And I think it's easier for the patient to go on that ride with somebody who they can relate to. So we just decided, hey, let's do an all encompassing men's health facility. Let's build it and they'll come. And we've been open now for just a few months and things have started off, as most businesses do, slow, but they're really picking up now. And now we have a good couple dozen concierge members and people that come in for all different services, if it's IV fluids, if it's skin treatments, if it's hair treatments. But for me, it was just about stepping out of the box and building something that I haven't seen out there, something totally different, kind of pioneering this new path of men's health. Because like I said, I feel like there's a lot of places women can go to. If it's a med spa, if it's a female doctor, if it's whatever it is, a wellness center, a lot of these things cater to women. And we just didn't have a place for men. So I said, let's get it going.
Is there anything else you'd be open to sharing? You had your Achilles rupture.
I had my Achilles rupture in high school when I was playing football. I had a complex dislocation of the metacarpal phalangeal joint, and what that is the knuckle that attaches your finger to your hand, and tore all my tendons. So I had to have surgery.
Oh, wow.
To fix all the tendons and to put the bone back in place. And at that time, the hand surgeon that operated was a really reputable guy. He had known nationwide for his hand surgery. Wrote it up in the journal because it was only the 5th reported case in history of that injury to that particular finger.
Interesting. Wow.
Yeah. And besides that, no other surgeries or bodily injury. Well, I guess I did fall out of a tree and broke my wrist when I was little on Thanksgiving Day. So that really made my parents happy. But besides that, just the typical stuff, I'm completely transparent with everything I do. I did my blood work the other day. My testosterone was low. And it was low. I mean, it was low to the point where the lab was like, "Excuse me, ma'am, I think you need some help here." And I'm like, so I got started on that, and I feel so much better. I've been on it for about a month. Energy levels are up. I'm sleeping better. I feel youthful again. And for me, it made all the difference in the world. And a lot of times we don't even know how bad we're feeling until you supplement what's missing. We'll go through life thinking that this is the norm. But then when you do a deeper dive and you start finding little things and fixing them, you realize, crap.
How much of a difference it makes.
Yeah.
I didn't realize I was living like this.
Right. Yeah.
What do you see most? Like what kind of pathologies and issues and things that patients ask you the most?
Yeah, I think right now, since we're doing a lot of like more integrative medicine, functional type medicine. So most of the guys that come in are about maintaining health or just feeling better. On the concierge side with the primary care, the bread and butter of all primary care, as far as pathology goes, or diseases go, is hypertension. High blood pressure, diabetes, overweight. Weight's a huge issue in the United States.
Yeah, totally.
I have conversations with people all the time, and it's like this ongoing kind of joke in the world that if you travel abroad, you can tell who the Americans are because they're the big people that are walking around.
We were talking with somebody recently. They were in Europe and then they came back and they were like, I was eating more and enjoying like my trip, and I felt better than when I'm here and I eat less and I'm like just trying and like I just feel bloated and like lethargic and stuff like that.
Yeah, it's great. I've experienced it myself.
So what is that?
It's it's this whole, and regardless of what people want to say and align themselves with, and what do you want to call it, they're calling it the MAHA, Make America Healthy Again, this movement, where if you agree with politics or not, you put all that aside, and what they're doing right now is revealing how toxic life in the United States has become with the preservatives in foods, the hormones they're putting into the proteins here, pushing the fast food, making, the bad food easier to get than the healthy food. And so the fact that they're focusing on that, I think is great.
So the like processed food,
everything that you can put in like a microwave and anything you can pick up through a drive-through window, and, the amount of salt and preservatives they put in it's just not good for you.
So that leads to chronic
illness. So everything starts with your weight. A lot of people, when they start gaining weight, that's when all these problems start happening. Your blood pressure goes up, your sugars start to go up because you start down regulating your insulin receptors because you're kind of abusing them with all the carbohydrates and sugars that you're consuming. It puts stress on your joints, and that kind of speaks to your world. A lot of people that are overweight have low back problems, knees and hips and ankle problems. And so, we're just an unhealthy and very inactive society. Although I'll tell you that I've noticed a tremendous shift in the last couple of years.
I feel like I have
focusing, on their health.
Awareness of that, and like, wait a second, what should we focus on?
Yeah.
It's when we mentioned too is like, where do you go for things that's not processed? I'm always searching for ideas and stuff like that because it gets more challenging and picky of like where you can go to get that stuff.
Yeah.
But I've had, other people that are really into this, that world and stuff, and they're like farmers markets, like direct to farmer meat.
Yeah.
And then produce, similar kind of thing.
Yeah.
Or they grow their own stuff. And
I
love that idea.
I love that idea.
There's no way, right? Do we have 3 kids right now? Like, there's no chance. We have no time for
No, I mean, and it's still, and where do you have the space for it? And they do have these indoor things. They're getting pretty creative and innovative with some of these like kind of growing systems that you can do with hydroponics in your house and stuff like that. But most people, don't have the room to like farm, know, and so even when you go to the supermarket, you have options. You can get the organic stuff or you can get the other stuff, but then the price difference is a real problem for people.
Yeah, I also heard something from a guy that's from Brian Johnson. He's the guy that does the Don't Die.
Yeah, he sounds yeah.
He's like 47. He looks like he's like 18. But anyway, his goal is to age the slowest possible.
Yeah.
So I think it's just interesting. I'm like, all right, I'm going to take what I can, like see what I can hear from this guy and see what he has to say with some things. But anyway, I heard they were describing a study of like what meat from what sources has the most microplastics.
Oh, God.
So what's going to be the best for you? And a lot of it's the packaging that it's just like put in, not aside from like the GMOs and, all the stuff that the farm, the produce that they're eating, like the cows are eating or whatever, the environments the chickens are raised and all the environmental toxins, even just that aside. But then they're packaging it in plastic, then and shipping it around. But one of the highest density microplastics they're finding in organic meat was from Whole Foods.
Really?
And I was like, oh my gosh, like that's supposed to be the place where everything's like fresh and like
that's a safe space,
organic.
Yeah, for
Finally, even the air in here is cleaner. This meat's got to be good.
Yeah.
That's what anyway, I don't know. I mean, that's just what I had heard. Please, people, do your own research and investigate that. I'm always open to ideas and stuff and suggestions, but like, I was like, okay, so then where do we go? You know,
it's frustrating, you know, because you don't have to go too far. I mean, you know, because I traveled to Spain a few times. That's where my dad went to medical school, so we've gone to visit a few times, and I'll eat, you know, normal, or I'll go out and have, you know, a nice steak dinner, and I never feel bloated afterwards. I never feel, you feel like walking and going around and sightseeing after you eat. You know, you go out to a big dinner here and you just want to go home.
I want
and
to lay
just,
down.
Just let a truck run you over, because it's just not, you don't feel good.
That's not, it's not ideal.
No, but and to your point with the supermarkets, you know, like, when in the world has, you know, fruit been able to last like 2 or 3 weeks on your counter? Like, that's not,
It's not normal.
yeah, it's not what's supposed to happen. You know, you're supposed to buy it and eat it, you know, not just have things stay, but they do it on purpose so that it lasts longer. And
it makes it more convenient.
So,
So corporations are diving into like, how can we make things cheaper and more profitable on our end,
right?
and last
look
longer,
nicer,
and then look nicer. Just the look, to make things fluffy like bread, or just fruit look brighter, with wax over it, or like
they spray some wax on it,
on the apples. But I had heard that, I forget what the label was, but like I had seen this. So an article, someone was describing like, if you scrape the skin of the apple, you can get you can see like, oh, there's a bunch of wax on here.
I saw a video about that.
Yeah. And I was like, oh man, but I looked at the apples we're getting, unfortunately, you know, we're getting like the organic ones from Costco is what we usually go. We live at Costco. Oh my gosh, for our family. Yeah. And they're good. They're not the waxy
ones. You have 3
ones.
kids. It's a good place to go to get bang for your buck.
Exactly. So so the other one would be environmental toxins that I've heard a lot too, of just like, as an example, farming, pesticides in the air, and then golf courses in the area, and pesticides in the air just for maintaining the irrigation. You know?
Yeah, no, it's bad, you know, and there's been a lot of focus on that lately, you know, and one of our biggest kind of agricultural businesses here is the sugar industry, you know, and a lot of people try to kind of pin, you know, some farming practices on the algae that's growing into the rivers and the feeder systems that go out into the St. Lucie, whatever it's called, the bay up there or whatever, and into the intercoastal, and I don't know that it's coming from them or from where it's coming from, but there's definitely something to be said about the pesticides and stuff. And you don't have to look much further than, listen, you can have every intention of eating healthy, and people will focus their diet on fish, and then you come to find out that you have these elevated mercury levels from eating something that you're supposed to be eating, and something that's healthy for you, and it's doing you harm. So it's almost like, you know, even when you try your best, you can kind of shoot yourself in the foot. So
hypertension seems to be one of the most common pathologies, and it starts with just being overweight.
A lot of it comes from being overweight. You know, everything in healthcare is very multifactorial. There's genetic components to it, and then there's environmental components to it. There's not much you can do to change your genetics, but there's usually this like 2-hit kind of model where you have the genetic predisposition for something, but something environmental triggers it. So
now it's expressed.
So then it expresses, it comes out and it rears its ugly face, and then you just got to deal with it. And a lot of times with high blood pressure, now don't get me wrong, you're going to find people that are in shape and skinny that have high blood pressure, people that are in shape and skinny that have high cholesterol. That's kind of out of their control. But the grand majority of people, it's just lack of physical activity and lack of a good diet.
Interesting. Yeah. I had my blood work done recently, and my LDL was higher than, I mean, what would be ideal, you know? Yeah. And I'm like, man, it's interesting, because I feel like I definitely have cheat meals, but you know, the weekends, usually I let a little bit more loose, or snacking if my kids happen to get to bed early enough. And I'm like, I have like 45 minutes before I need to get to bed. Like, this is insane. Like, I want to have a snack. That would be the only times, you know? But anyway, I'm like, what do I do? It had been like this actually for like probably 10 years. Cause when I first started when I graduated grad school 10 years ago, I had my physician's appointment with my previous job. This is in Texas, and they're like, "Yeah, your LDL is like elevated." And I was like, "That's like how, you know?" Right. But anyway, the suggestion was like it's a combination of like just the nutrition. It's nutrition, maybe some environmental, but mostly nutrition. and then examining like what things in the like, let's talk about your diet, right?
Right.
And then what of those things might trigger maybe an LDL type of elevated thing. And cheese seems to be one of those things for me.
Oh
I
yeah.
don't know if it's dairy. I don't really have that much dairy to begin with, but anyway, the cheese. And I was like, interesting. I didn't even want to thought of that because like I have a whole 3 eggs in the morning every day, and then like either a tortilla like or a bagel or like a croissant or something like a little bread. All right. And then I'd put cheese on the eggs.
Yeah.
And then at nighttime I'll have like, if we have my wife will make healthy dinners and stuff, I'll put cheese on quinoa or like cheese on something else. I'm like having cheese more frequently, and I was like, I didn't even realize I was doing that.
Yeah, and so one of the things that's really interesting about cholesterol in particular is, in the medical field, it was all about cholesterol back in the day and low fat diets and lower your cholesterol. But then we've seen time and time again where people with normal cholesterol levels are dying of heart attacks and atherosclerotic plaque, and people with elevated cholesterol have zero cardiovascular disease. So there's something more to it.
So there's a disconnect between just the elevated LDLs,
correct,
and then heart or cardiovascular disease.
100%.
Interesting.
And what we found is that, so one of the things we do at Men's Only Medical too for our concierge members is we do their first blood work. We do it on us. We pay for it because the insurance won't pay for it. They deem it unnecessary because we check inflammatory markers, heavy metals, autoimmune markers.
It's like a full panel,
hormones, and not just your testosterone. We're checking your FSH, your LH, your estrogen levels, your prolactin level. Like we do everything. And one of the things we do is we do this fractionated kind of cholesterol panel. So we don't just get your LDL, your HDL, your triglycerides. We get what type of LDL you have, the size of your LDL, the size of your HDL, your apolipoprotein B. We check the full deep dive into the cholesterol because there are certain types and shapes of LDL that are more kind of atherogenic, where it can cause atherosclerosis in your arteries, and others that are very low risk. So you can have a very elevated LDL, and if you have the good type of LDL,
you're good.
You're really not at that much risk for heart disease. Plus, your HDL, when it's elevated, becomes cardioprotective. So you can offset some of that elevated LDL with a high HDL.
How do you do that?
Just changing your diet, changing the types of oils you cook with, eating healthy nuts and stuff like that. Just kind of eating cleaner fats.
Yeah.
And the other thing is inflammation. Inflammation is a huge thing, and it's not just for joints anymore, and we found that also people who develop heart disease have a lot of inflammation inside of their arteries, which allows for the plaque and everything to stick to the walls easier, and then contributes to the blockage that'll cause heart attacks and strokes and stuff like that.
Yeah. Interesting. So the good fats, like polyunsaturated fats, monounsaturated fats, where nuts would be an option.
Yeah.
And I would imagine like this is also too, like, I mean, a different specialty of like what type of nuts and like what would be good for them. So you see, all right. So I would imagine high cholesterol, hypertension, and then inflammatory markers on the blood work, common things and if someone's overweight, they're feeling lethargic, they low libido. If other things hurt, like their back and their knees and stuff like that, that's a common profile.
And the frustrating thing to me is that when you go to your traditional PCP, your primary care physician, they're going to tell you your cholesterol's high, your blood pressure's high, you need to lose weight, you need to eat better, and that's the end of it.
And then take these statins.
And then here's your statins, here's your medications, and then you're kind of left to fend for yourself. Where if you had better guidance and instruction on how to lose the weight and how to eat healthier and what type of activities you can do to start getting some of that weight off, you would have a good chance of losing the weight, dropping your blood pressure, normalizing your cholesterol without even having to be on the medications. And that's what the approach we take at Men's Only Medical. We don't just reflexively prescribe medications to people. We're not there to ignore their healthcare issues and their medical issues, but we want to address the root cause. We want to get down to why these things are elevated. Now, don't get me wrong. If we give it the old college try and we give them the guidance that we need to give them, and we'll come up with a 2 or 3 page protocol with all sorts of things that they can do, from different supplements to the type of nutrition they should intake, to the type of exercises, to even biohacking recommendations like cold plunges and infrared lights and different things that you could do. And we do that, and you're sticking to that, and you come back and you've lost the weight, but your cholesterol's still high and your blood pressure's still high. Then we're going to have an honest conversation about starting medications. But a lot of times you start a medication and it leads to side effects. And then you have to take a medication to cover the side effect that the first medication, caused. And now you're
just a cocktail of meds.
Yeah, you're just sliding down that slope.
100%. And we've all heard cases of that where like someone's on like 14 things, just to counteract the other meds.
It's so bad. Yeah.
It's a bummer,
Oh, it's horrible.
And with the medication stuff, right? With statins, another thing that I've heard a lot of was joint pain is a common thing with that one.
Yep. Muscle pain, joint pain. Yeah. It's the number one reason people stop taking it.
But at that point, what were the other suggestions? Like imagine like an allopath, like a Western insurance-based, what do they do then?
So what you would have to do is start them on one statin, find out they have a side effect, change them to a different statin. This is what the kind of protocol is in traditional medicine. And if they have a side effect to that, all that has to be documented. There are other medications now like Repatha and other things that are injectable that'll lower your cholesterol. That is not a statin. And we also have other kind of non-traditional treatments like plasmapheresis. So people are doing what's called therapeutic plasma exchange, where you get connected to a machine. It'll take your blood out, run it through the machine, and then put it back into your other arm after it filters out all of the certain substances. It'll filter out your heavy metals. It'll filter out inflammatory components, and it'll also filter out cholesterol and triglycerides. So with people with significant issues with elevated cholesterol and triglycerides, it's actually a medical treatment. But you have to jump through all the hoops before you can get there because it's a very expensive. It'll cost like $10,000 and insurance isn't going to pay for that.
Yeah, of course. And you mentioned type 2 diabetes. That's what you meant, type 2.
Yes.
From my understanding, that's reversible.
It's most of the time with type 2 diabetes, it is attributed to lifestyle. So if you can lose the weight, we usually see the kind of typical, and it's not everybody, but the typical type 2 diabetic is overweight, has not very healthy eating habits, and is very stationary. So if you can get people moving and eating well and losing weight, you can bring that patient's sugars down to a level where they wouldn't have to be on medications. Now, it depends how deep they are into it. Some people, they can be doing all the right things, but it's gotten past a certain point and they're always going to have to be on some type of medication.
Yeah. Gotcha. But there is hope, at least.
There's absolute hope.
It'd only be a benefit to try that route.
1,000%.
It's part of the protocol.
And you should do it regardless if you're on medications or not.
Yeah.
But to your point, type 1 diabetes is unfortunately, it's an issue with production of insulin. So you have to introduce the insulin to the body since you're not making it yourself.
Yeah. Have you seen a lot more incidents of like type 2 diabetes?
In my career, I've been in healthcare now for 20 something years. And I would say it's just always been a big problem. It's just always been a big problem. So have I seen an uptick in it? A slight uptick, but I think it's only because when I got into healthcare, it was already a huge problem to begin with.
Interesting.
Yeah.
Is there something you've seen over the last several years? It's like this has increased a lot of incidences.
That's a great question. Something that I've seen a lot, and I get to experience it more secondhand because of my wife, is cancer. Not any particular type of cancer, but just cancer in general. And I can't help but think that it's got to be related to a lot of these toxins that are either in our food, in our environment, in our surroundings. And we're just seeing, and my wife sees it. She'd tell you if she was here, it's crazy how many more people are getting cancer these days and how many more women are getting breast cancer younger. It's almost a weekly thing that she gets biopsies of a 30-something-year-old woman with breast cancer.
Wow.
And I would say that, 20, 30, 40 years ago, and I don't have the data to back it up, but I would strongly suggest people look it up because I firmly believe it, and I would be extremely shocked to find out that the data suggests something otherwise. But more people have cancer these days, and people are getting them younger.
Wow.
Yeah.
I mean, fortunately, I don't have any firsthand experience with that, and not my field and what we see, but I could believe that, I know that something recent, like I feel like type 1 diabetes has been more prevalent over the last couple decades for the same kind of arguments that I've heard, and that's just interesting to me, and of course, parents would feel extremely guilty, right? Of like, I'm feeding them this stuff, and how would I've known otherwise, or whatever. All the dietary, intakes of not knowing how processed everything was, just not knowing otherwise. But anyway, I think like that's been more prevalent.
Yeah. I just think, and the thing is, when you get into family medicine, you tend to live in the world of internal medicine, because the traditional family physician sees kids of all ages from birth to death. We're all encompassing. But because there's so many pediatricians and so many options, people typically take their kids to the pediatrician, and then the adults will come and see their family physician.
Right.
And in type 1 diabetes is a lot more common in kids. Obviously, those kids go on to be adults.
Right.
But we do see it a lot in kids, and I would say that that the pediatricians would probably tell you that they're seeing a lot more type 1 diabetics these days than they did in the past. Yeah,
it's terrible. I mean, we'd love to hopefully make a change with that, with just more awareness and recognition and stuff like that.
Yeah.
What do you feel like is going to be the next? Like, what do you think the shift that we're seeing in medicine, healthcare, overall health and wellness, and from your end, from what do you think is going to be the next? What direction are we going? Like, what's going to be really groundbreaking for people?
I think it's all the non-traditional stuff. I think it's like it's really the wellness component of medicine. It's really digging into preventative medicine, and not in the way that we've always talked about it, which is screening tests and vaccines and all that kind of stuff. It's making sure that we are consuming safe products, that we're not experimenting with unsafe products, that we're moving more and exercising. And if we do that, and we can get our population to shrink, not in the number of people, but in the size of the people, then we're going to have a lot less disease moving forward.
Like body mass index is shrinking.
Yeah, BMI. Yeah. If we can continue to go in that direction. Childhood obesity right now, I was reading some really disturbing studies. I mean, it's something like 1 in 3 kids or something is overweight or obese. It's just, it's kind of sickening, and with the advent of gaming and these personal
Social
devices
media,
and iPads and cell phones, and kids don't get out as much as they used to. And then if it starts as a kid, you just end up being an unhealthy adult.
That lifestyle that's the habit, the normal.
Yeah.
That's the new norm. I totally agree. We, something because we've heard from a lot of different parents and stuff, and my family members that have, as my nephews and nieces and stuff like that. But they're like, a little bit further along we are with our kids' ages, and they were like, yeah, we're not getting our kids a phone. What I had heard from an expert was, when you're ready for your kid to have anxiety and insecurity and depression, then get them social media and a phone.
Yeah.
Like, well, I'm not ready for that. No, I will never be ready for that.
I'm never ready for it. We get in fights. I have an 11 and a 13-year-old, 2 boys.
Oh, okay.
My older son has a phone now. He's about to start high school next year, and it's more like we want to be able to communicate with him when he's out with his friends and stuff. And the 11-year-old just like, when's my phone coming? And we're just like, you're not getting a phone yet.
Yeah.
You're not. But my brother got one when he was this age, and I'm like, well, you're not your brother, and for now you don't get one, because we know once we get it to him, you kind of lose the kid, and they start going down the rabbit hole, and try to get them out as much as possible. It's just harder these days because kids are, into different things. They had to call us into the house when we were little.
Yeah, it's time for dinner. Come in here. Yeah.
It was just dark out and you're
Your parents
full
are
of dirt.
Yeah.
And it's just,
Parents are driving around like, where were you?
Yeah.
You know we have dinner at 6.
right.
It's like, I forgot to track time.
Yeah, sorry.
It wasn't
I
a watch.
don't have a cell phone.
Yeah. So we started playing Manhunt. It was like dark now. Perfect.
Yeah. I mean, but those are the good days. And I think if we can get kids active again and excited about being outside, it would go a long way in helping them when they become adults.
Yeah. For that continuous lifestyle.
Yeah.
What about musculoskeletal stuff? You'll see some of that.
Yeah, I mean, I see a lot of wear and tear stuff. When I start seeing men as adults already, a lot of them are former athletes. A lot of them, if they're overweight, so it's a lot of low back pain, a lot of knees, a lot of people with pain in their knees, and again, I think the way that we've started looking at medicine and treating these things has gotten, I would say, healthier as well. Because before it just used to be, hey, we'll give you a cortisone shot. And that's great. It's a really good anti-inflammatory, and it's going to decrease your pain and inflammation for the time being, but it's going to come back. You can only do it so many times before you start causing more damage to the joint than helping it. Not to mention that those cortisone shots increase your blood sugars. That's what it does. So we're actually contributing to more problems than helping the person when we go that route. These days with peptides and PRP injections and stem cells and exosomes, so many different things out there that you can use that help people's bodies regenerate themselves and kind of heal naturally, as opposed to introducing, anti-inflammatories and or prednisone, which is also an anti-inflammatory, but a different type of anti-inflammatory. I think is going to be really helpful and beneficial for people. So yeah, knees, backs, ankles, a lot of Achilles. I know I was talking about it earlier, how I blew out my Achilles. I just personally, friend-wise, I know a bunch of guys who, it's every day I play tennis. I wake up the next morning and I can barely walk because my Achilles is painful and it's bothering me and stuff like that. And, a lot of those things become chronic issues because nobody gives themselves enough time to rest and to get the inflammation down. So they're dealing with it for weeks, if not months.
It lingers.
Yeah.
Tendonitis lingers.
Oh yeah.
But because we see that a lot, stuff like that. For that kind of stuff, and I was going to ask about the cortisone injections. What is it that, when would you advocate for a cortisone injection first? Like when it's like, yeah, let's, I think it's a good time.
Yeah, I think if somebody has, kind of more of an acute pain and it's nothing that seems that it was from like a significant injury, if I'm not worried about a significant tear and it's just inflammation, maybe some mild swelling, it's a quick fix, and it's still a really good medicine. It's a really good treatment. Everybody that I've given, let me not say everybody, most people I give cortisone shots to in a joint tell me within a few days, I don't have the pain anymore. So
it's good at just like quickly bringing down a lot of heightened inflammatory pain.
Correct.
That they're debilitated. And it's like, all right, now we got it like settled. Now let's do some stuff for it.
That's what and very well, a lot of stuff, even like the knee, for example, people deal with the knee if it's mild osteoarthritis or if it's some type of inflammation of the soft tissue, meniscus or whatever it is. People don't give themselves they don't afford themselves the time that they need to let it heal or to rest or anything. People want to be active, but they're kind of re-aggravating the injury.
Yeah, totally.
So if we can calm that pain down and then start strengthening the muscles around the joint to give that joint more support, you can actually help prevent it from recurring.
Yeah.
And again, instead of giving the cortisone shot, which is an anti-inflammatory to reduce the swelling once it's there, after you've done that, let's go in the world of PRP or exosomes or the peptides, where it can now helps your body naturally calm that inflammation down, repair the tissue that maybe have micro tears and stuff in it, so that you don't have it recurring down the road.
Right.
So it's a good kind of fire extinguisher, the cortisone, but it's not going to fix the problem.
That's a good one. Fire extinguisher.
Yeah,
totally. What peptides do you usually recommend for that?
There's a couple different ones. God, why is it just escaping my mind right now?
So no, a common one's the BPC.
Yeah, that's one, the BPC. Yeah, BPC 157 is the one we use. Because I was just thinking, we just started talking to some guy. He got some other stuff, some AOD and some CJC and ipamorelin, but those are more kind of to help kind of build muscle and the growth hormone analogs and stuff like that. But yeah, the BPC, that's the one that we use for all the joints and soft tissue inflammation and pain.
It's interesting. You were mentioning the like wear and tear, joint pain, stuff like that, like breakdown. Similar to the LDL, where it's like, well, some people have elevated LDLs and they have no cardiovascular issues. And then some people have low LDLs and high cardiovascular. So like there's a disconnect between just like LDL and cardiovascular, right? Similarly, what we've been exposed to and like what we talk with all of our patients is we can't change anything with like the bone, right? The cartilage, degenerative changes, whatever. Like we're not going to go in, we're not surgeons, so we don't go and fix your labrum, like whatever. But a lot of the research does show like there's a huge disconnect between abnormalities found on imaging with labral tears, cartilage defects, or chondromalacia, breakdown, osteoarthritis, whatever, herniated discs, facet arthropathy, nerve issues, or whatever that cause sciatica type symptoms, right? Referred pain, and then the imaging, where there's people that have like pretty good looking knee MRI or X-ray, and they have like a lot of knee pain and swelling. And then there's people that have like, that's kind of bad, you know, like a lot of bone on bone, or like narrowing of the joint space in the hip, or like narrowing of the disc space in their lumbar spine. We're like, I feel pretty good. What do you mean? They're like moving around and they're super limber.
Yeah.
It's like, there's a huge disconnect then between what the imaging is showing and what their functionality, prognosis, and pain. So people, and it's very commonly people will come in, not as common as you would think, actually, because the type of people that we see are, you know, they're very motivated and like enthusiastic. They're like, I don't want to do that route. I want to fix this thing, like, and I'm going to take the slow route. Like, I want to do what I need to do, you know?
Yeah.
But anyway, they're some still, though, occasionally people, they're like, but I have a herniated disc. And I'm like, that's, everybody does, you know, like we can't change that anyway. Everybody has a herniated disc. It's pretty ubiquitous, but hey, like 75% of people over the age of 43 have some kind of abnormality found on the spine on an image, but you don't see 75% of people hobbling around in severe back pain and referred neurological pain. So like there's hey, this is supposed to be encouraging and hopeful. There's a disconnect between what they're finding. So you had no pain 6 months ago, but now you have like debilitating back, like your back's hurting a lot and you're having some referred pain. The imaging doesn't change that quickly. So 5 years ago, a year ago, you had no pain, but now you do. Your back didn't change that much in a year of the image on the MRI. Right. Where like it looked identical. So that means you can get back to a pain-free state without changing the internal structure. So like it's supposed to be encouraging, right?
Yeah, you know, it's really interesting that, and you make such a great point, because one of the things that everybody should do, and what I pride myself on, is treating the person, not a result. And that's why I don't reflexively prescribe a statin for everybody whose cholesterol is elevated, because everybody's different.
Yeah.
And really individualizing the care, because if you just do a certain study and get a result and then reflexively treat it, it may not be a problem for that person, you know, but now you're introducing a treatment modality that they may not need. So really personalizing the care, and treating the patient, not a result. You know, I think it was that movie Patch Adams with Robin Williams.
Oh yeah,
one of my favorite movies. Yeah, and he just says at the end, you know, you treat the person, not the disease.
Yeah.
You treat the person.
You need more compassion.
You're going to win. You know, and so you can't just always base it on a result, and you can't just haphazardly just order tests, because you're going to find something.
Yeah.
You know, and there's this big trend now of people doing these full body scans, like as a preventative type thing. Oh, just get me in the CAT scan machine and just do a full body scan. On one hand,
yeah, what are your thoughts on that?
You know, on one hand, you know, knowledge is power, you know, and if there's something really bad and you catch it, then you can treat it. But 9 times out of 10, you're going to find something, and it's going to lead you down a rabbit hole. You're going to find some type of benign nodule or cyst on some type of organ that's going to lead to further testing, non-invasive or invasive, only to find out that it was nothing anyway. So now you've increased your costs, you've increased the stress to your body,
exposure to
something,
testing.
to radiation from a CAT scan, or we have a full anesthesia from a biopsy, or
the full body MRI, like same thought.
Yeah, I mean, the full body MRI is different because it doesn't expose you to radiation, but again, it can still lead you down the same rabbit hole.
So your suggestion would be like, all right, if you're going to do that, just go in with the right mental expectation.
Correct.
And then not like jump off a cliff when it's like, oh, I have a small little thing. Like,
right. You have to, that's why I think it's important. You have to be on the journey with your patient. You can't just let your patient go off on their own and try to figure things out on their own. You really, if you're a good physician, you're going to walk that path with your patient. You're going to be communicating with them. You're going to be reassuring them, and ideally doing what's best for them and what they need. You can't just do the same thing for every patient that walks in through your door.
Yeah.
It's just not. Again, that's kind of going back to this whole protocol-driven insurance metrics that they're pushing. You have to individualize and personalize the care, and not everybody's going to need a full body scan. Not everybody's going to need, peptides or hormone replacement or to be on a statin, regardless of what their cholesterol is, or be on this blood pressure medication versus another one. You have to really be on that journey with them and care. And that's why, going back to our earlier conversation, I love the concierge model, because it allows me the time and the ability to learn about the patient, educate the patient, and then go down the journey with them.
One more question about the cortisone injections. I've heard different thoughts on this. How many would you say, like let's say, hey, like a knee or a back, or whatever, and they're going to inject it? How many injections could that individual joint tolerate? Or is it a systemic?
3 injections in any joint is the max you should ever do. You do more than 3, then that cortisone is actually going to start wearing away at the joint.
Breaking up the cartilage, right?
Yeah.
That's what I've heard.
Yeah.
Interesting. So 3. You got like 2 free tokens, third one's pushing it.
And what we find is, you get the first one, that alleviates the pain and inflammation. 3 months later, it's back. You do a second one. 1 month later, it's back.
So it becomes decaf.
So they start needing them more frequently.
Yeah.
And that's why I'm saying it's gonna put the fire out, but it's not gonna fix the issue.
I had a patient that this person was a younger person, chronic back issues. They were young, like they were mid-20s, but chronic back issues, and tried multiple routes of some things. I think had like at least 2 surgeries on it, and probably had, at this point that I met this patient, 20 injections in their lumbar spine. And I was like, and they're like, do you think I'm okay? And I'm like, oh my gosh. They're like, it's been bothering me a little bit again. I think I might go back for another one. I'm like, stop immediately. Yeah. It's my opinion. I can't tell you not to do that. Yeah. I'm just saying, like, in my opinion, I would say I would wait. But I'm like, who's doing this for you? Like handing out like candy.
Right. You would almost think, hey, it's your medical professional, trust them, but to a certain extent, it's also a business.
Hopefully. Yeah, right. Exactly. That's the ethics that come in. It's like, well, and with recent events, and again, we're not going to get political with that, but just always question over the last decade, were some things pushed for, is there some kind of financial incentives or conflict by any means? Mm-hmm. But then again, this patient too, like, patients are all, as we know, they don't always know exactly what the doc is doing, Yeah. So they might be communicating exactly what so hopefully it could have been mistaken that it was cortisone every time. I don't know. It could have been something else.
Yeah, I guess we don't know. Yeah.
But they were pretty educated, and they're a Googler, they would Google it and they would research everything. So they were pretty on it. And I was like, oh man, regardless,
well, and the thing I'd say is, it's a lot. So I would say, hey, after, I don't know, 10, and you keep having the same problem, maybe it's time
another direction,
something different,
Yeah, and something else might be.
You don't need to get to 20 before you say, hey, well, maybe something else.
And they were like, it was like, I think 21 is going to be it. Like, I think I feel a little bit of stuff, and I was like, oh my gosh.
Oh, yeah, no, this is the last one. I swear. Yeah.
Oh man,
until the next one.
If only we would have. I'm always like, if we could have talked 2 years ago. This is a 2-year span of back issues for this person. I think 2, maybe 3 years. I was like, man, if we could have just talked, I could have talked you off this cliff. Way different trajectory. That's something like with team members that we bring on, and like patients we talk about, and like with patients we bring in. I'm always like, the stakes are high, because like when somebody calls us and they have back pain or neck pain or shoulder pain, whatever, like we love helping people. By no means can we guarantee anything. We've had good outcomes with the right individuals. Sure. And we're confident that like this recipe that we're able to present is helpful. If they don't come in to see us, right, then like, what are the other options? It's usually that other route,
right?
Where they descend into like more meds, injections, surgery, whatever. They're just despondently living through pain. That nothing's getting better. I'm like, so the stakes are high because it's a way different life trajectory. Whereas like other people that are success stories where they were going there, where they weren't sure what route to go. Fortunately, we were able to help those people, which we're not always a fit for everybody. Totally understand that. We're not guaranteeing anything. I'm just saying like we've had good success with some people, and the people that we did, they were on the fence. A way different trajectory. Now they're exercising. They feel really good. They listen. They did the homework that we're supposed to be doing, and like now they're able to work out and exercise. And other than the opposite, which would be like a way different trajectory.
Yeah, I think it's one of those things where you really need to educate the public, not you or I, but in general, there has to be an education, so that people know what their options are.
Yeah.
Because even that patient probably thought he was doing the right thing, because he didn't know any better.
Yeah.
And he's like, this is what I'm supposed to be doing.
Yeah. Being misguided.
And
then it's like, what rationale? I don't know. I'm not making allegations on anybody, but
I don't know the situation at all. But at the end of the day, there was some type of lack of education or of alternative options that this person just didn't have. And
I think that's one thing. And we can land the plane here, but like with social media and the connectivity of information, at least that is an avenue where people are getting a little bit more exposed to alternatives and different things.
Yeah. Double-edged sword there.
Double-edged sword. They're just like, okay, within reason and moderate, and then guidance with the younger individuals and stuff like that.
Yeah. Because you got to take it a step further. It's, you see some people are just those people that believe everything they see, and you see it on social media and it's the new best thing, next thing you know, you're eating like, ground up tortoise feet. And you're like, what? This is supposed to help me?
Yeah, exactly. Because like one influencer said that.
Yeah.
Like, oh my gosh, relax.
Right.
Well, we'll end it here. We'll have to get you in again. Like we can dive into other stuff next time too.
Great. Yeah.
But tell people where you're, like how they can best reach you and like get in contact with you.
Yeah. Men's Only Medical. We have a website. It's mensonlyMedical.com. We're downtown West Palm Beach, 116 North Dixie Highway on Dixie between Banning and Clematis in downtown West Palm. Our phone number is 561-725-0206. I invite anybody and everybody to come by and check it out. There's obviously no commitment. You get to come in and meet and hang out with one of the coolest doctors you'll ever meet in one of the nicest environments that you'll walk into as a doctor's office. And at the very least, you get the, not just because I'm saying you get to meet me, but I don't think anything bad comes from having conversations, and there's no commitment for you to just come in and check the place out, have a conversation and see if it's going to work for you or not, but we're really excited about it. And it's really one of a kind of place. There's nothing else like it that I've seen that's just for men.
Cool. Yeah. That's awesome, man. Well, thanks again for coming in.
I appreciate
sharing your insights and stuff.
Yeah.
And if y'all ever have any questions, comments, concerns, conflicting opinions, like please always reach out. We're always open to different ideas and conversations and stuff. And if you're battling any like pain that you feel like is limiting you with like an active lifestyle, we'd love to help. We can at least chat on the phone and talk more about what you have going on, if we're a good fit for you too, and maybe what direction at least to guide you. And if, like I said, if you have any questions, please don't hesitate to reach out, and we'll catch y'all next time.